Hello, everyone. Good afternoon, and thank you for joining us for this National Alliance to End Homelessness webinar focused on the state of homelessness, the 2020 edition, our annual report that highlights homelessness and housing data. Just a couple of housekeeping announcements as we are getting started. All attendees are currently on mute. The Zoom chat function has been disabled, so please enter your questions in the Zoom Q&A box. And you can do that throughout the session, and towards the end, we'll get back to those questions and have a conversation. We would like to highlight a couple of avenues where you can stay connected to the Alliance. One of them is through our webinar series, NAEH COVID-19 webinar series, and there's a link there on this slide. We also recently started a Ending Homelessness Forum, which is a discussion group for people who are a part of our community and who want to discuss challenges, solutions, or learn about various new materials as they become available. Finally, we will be recording this webinar and we will email it to attendees after the session, and we will also post it on our website so you will be able to access it at a later time. My name is Joy Moses. I am the director of the Homelessness Research Institute. I'm one of the people who will be presenting on today's session, and I'm joined in the other box by Jackie Janasco, who is one of my colleagues and a research associate at the Alliance.
Hi, everyone.
So we have a really simple agenda today where we're going to talk about our State of Homelessness report, major findings, tools available through the report, and state and local considerations. Off to the right, you can see a snapshot of what that report looks like. Hopefully you've had an opportunity to visit our website before, if not to see the 2020 edition, a previous version. But it's an interactive page. It has written material to explain data, but it also has a large number of charts and other tools available so that you can better understand what's going on in the nation and in your state and local areas. This is just some of the basics of the report. I've gone over some of the things already, but I'll highlight a couple of others. So as I mentioned, we recently put up the 2020 edition, and it includes new features compared to previous years. One of them is that given the era that we're in with COVID-19, we included some health crisis predictions related to how many people may become ill and how many beds will be needed to serve them in adequate isolation and quarantine situations. As I mentioned, we have a fair amount of tools, charts, a major dashboard that gives detailed state and COC information. On the previous slide, you could see the thank you, Jackie. That's the front page of the report, and you could see a big map there. You're able to click on a specific state and see information that pertains to that state, and as well as to each of the COCs in that state, which was a big expansion for us this year. We also were able to include demographic data. We included information about rates of homelessness, which we'll talk about more later on in the session. And we wanted you to get a sense of system capacity issues in your states and COCs as well. So we'll also be discussing that a little further on. And we put an emphasis on individuals, which you will hear about shortly. You can find the report through this easy to remember URL link, which is endhomelessness.org/data. And we also have been publishing updated analysis or additional analysis on our blog periodically. So we urge you to look there, not only for further data related to the state of homelessness, but also for tons of other interesting materials developed by our colleagues. So it's a great resource. Our goal with the state of homelessness is to tell the story of homelessness in America. We have wanted to present the information in a way that is interesting, in a way that is full, so that people who visit the site have an understanding and can easily communicate some major points about what's going on amongst people experiencing homelessness in America. And we're hoping that we're providing you with sufficient tools to begin to tell similar stories about your states and COCs. This, without a doubt, the creation of this report was different this year. As we were getting started and moving forward, we were placed under quarantine personally, and everybody else throughout the country, and a lot of, well, not everywhere in the country, but various places throughout the country and throughout the world were also being quarantined. So without a doubt, it was affecting us personally, but even more significantly and much more importantly, it was affecting a lot of people experiencing homelessness now and who will be experiencing homelessness in the future. So it's very much something that looms large over the work for this year, and we pretty much consider this year's report that includes 2019 data as a beginning of a news story. It's a baseline. It's where we were and where systems were prepared to, how systems were prepared to serve and the challenges that they were facing before these major changes started happening. We consider this moment to also include the very potent political Black Lives Matter movement as well, that is also affecting the work that we do. Together, we think that these things will potentially change homelessness policy. And it's already, the COVID piece of it is already bringing in new money. Earlier this year, the CARES Act was passed, and it's bringing $4 billion for the emergency services grant into communities. There's also pending legislation, the HEROES Act or other bills that Congress is considering now and into the future, depending on how the crisis with COVID shapes and depending on what progress they make with rethinking policing, and both of those issues are going to have impacts on state and local politics as well. We know that COVID has a great potential to increase the number of people who are experiencing homelessness, which will greatly affect our systems. And there's a lot of discussion just in general about how we rethink services. Specifically congregate shelter, how healthy or safe is that model of delivering services? Are there other options? A lot of you are doing a lot of great work around developing rehousing best practices. So which ones of those are we going to learn about and want to replicate? And as I mentioned before, there's also parallel circumstances around policing reform, with many folks bringing the issue of homelessness into the conversation as one that specifically maybe we could do better than having police address the challenges there, and that maybe housing and other services would be a better approach. So depending on how those conversations develop, we anticipate that it will impact all of the things that we're going to talk about were the case in 2019. So we really don't know where we'll be 2 years from now or 5 years from now, but here's where we were when this all started. So here are some of the basics. It's worth going over these basic data points just as background, but basically from the point in time count, we learned that 567,715 people were experiencing homelessness in 2019. This was a rate of 17 out of every 10,000 people. There's some basic things that we should talk about in relation to who was in this group and what is going on with this group. The vast majority of them are individuals, which is why we talk about them, and we will be talking about them as among other reasons. They are largely male, men and boys, 70%. A significant number of them are unsheltered, 37%. And we have been tracking and concerned about the number of them that are COVID-19 vulnerable. Within our community, we have been talking a great deal about the number of aging adults and the way that that number has been growing and is projected to grow into the future. And we've also seen research that says that folks who are unsheltered have high rates of trimorbidity and various pre-existing conditions that may make them vulnerable to COVID. So we have a significant population that we should be concerned about during the crisis. We also talk a lot about the disproportionality amongst racial groups in the country, and that certain groups are much more likely to experience homelessness than others. We're going into the current crisis, we're a little bit concerned that homelessness was already trending upwards. It increased in each of 3 years, 2017, 2018, and 2019. Although no significant jumps, we still did not want to see those trend lines moving upward. And obviously there are concerns of where the current moment is going to take us. In looking at the service side, we've always been in a situation where service providers are unable to reach all the people who need their services. And we see a lot of indicators over a long period of time of providers increasing their emphasis on permanent housing solutions rather than just having people waiting it out in temporary situations. So I mentioned that I wanted to return to individuals, and the data points that we saw that make us concerned about this group this year and in the previous past years. So I already noted that most of the people experiencing homelessness are individuals, 70%. We have some members of that group who have been targeted by special attention in the form of policies and sometimes additional resources to address their needs. Those groups include veterans, people who are chronically homeless, people who are chronically homeless and unaccompanied youth. So in general, we've been seeing some positive movements within those subpopulations because they've received some targeted attention and resources, but unfortunately, most people are not in those groups. So roughly 2 out of 3 individuals experiencing homelessness are not in those groups, and that's about 254,000 people. And there's a reason to be thinking further about their needs and what's going on with them. And that's largely because of retrenchments in progress and somewhat stalled progress, which I'm going to talk about next. So when we looked at the long-term trends from 2007, which is when HUD first started publishing this data, between 2007 and 2016, largely the trend was each year there were some declines in homelessness amongst individuals, but over the stretch of that period, homelessness only decreased for 14%. Homelessness only decreased by 14%. And then after 2016, progress started to erode and counts started to creep up again. At this point, the percentage of individuals experiencing homelessness is only 4% lower than what it was when data first was collected. So as you can see on the right, this is the representation of those changes in a line graph. You can see the steady movement downward and the movement back up since 2016, and the line is almost back to where it was in 2007. We are very much concerned that changes related to COVID-19 will wipe out the remaining 4% gain since 2007, and that it could obviously be even worse than that, and we could see record numbers of individuals experiencing homelessness, numbers that we haven't seen since we started collecting data. A lot of huge numbers of people in our individuals group are unsheltered. If we look at the population of unsheltered people as a whole, most of them are individuals, 93%. If you take a different perspective and look at the individuals population as a whole, 50% of them are living unsheltered. So basically 1 in 2. This is the highest we've ever seen that number. It's a record high. The low was 42%. So at various points in the history between 2007 and now, we've made progress. The unsheltered homelessness definitely dipped for individuals, but 42% maybe not where we want to be, and we probably want to strive for much greater progress than that in the future. So there's some work ahead for this particular group. We also see some great disparities within individuals, as we see in other parts of homelessness and society in general, various aspects of it. As I noted, we've been paying particular attention to what's happened since 2016, when the increases in homelessness started to happen. We thought we'd dig a little deeper and see if the population changes have been even, and perhaps unsurprisingly, they have not. Homelessness amongst certain subgroups were much more striking compared to others. The ones that experienced the greatest growth were transgender individuals, Asians with 39% growth between 2016 and 2019, and American Indians. We see similar figures when we looked at just the unsheltered individuals. Big growth in those populations too. Again, there's some similar groups on this list, transgender and Asians, but the group that experienced the third highest jump was Hispanics and Latinxes with 50% growth. We think that these data points are significant for a couple reasons. One is the concern about the transgender group. Currently, the administration is considering policy changes that would take away the equal access rule, and that is something that helps that particular group and others ensure that they are able to enter shelters and receive services. That rule is in danger, and that's particularly of concern because that group is unusually left out in the cold, and their numbers as far as being homeless and being unsheltered have been growing. It doesn't seem like the right time to be further limiting their access to services. We were also interested in the Asian group being on this list. Quite frankly, we're not used to seeing that particular group. experiencing more challenges in relation to other racial and ethnic groups. We suspect that one of the reasons is that states where Asian people, there's a limited number of states that have significant numbers of Asian people, and those states like California, have been having housing crises that probably are affecting everyone. But we don't fully know the reason for those numbers. That's where we're starting our questions, and I'm sure we'll continue to ask additional questions and test those questions and until we understand what is happening there. But those things stood out to us as we were looking at the data this year. So I wanted to spend more time talking about race and ethnicity. I know growing numbers of providers and advocates who work in this space are putting a lot of energy into addressing race equity, as we are, and I'm sure we will continue to do in the future. So we want to highlight some of the numbers here as well, beyond what I've already said. So when we look at the counts for each of the groups, by far the majority of people who are experiencing homelessness are white and Black, and purely in a numbers way, and more white people are homeless than Black. But we have been trying to spend a lot of time taking another view, another focus, and that's looking at rates of homelessness, or the amount of people who are experiencing homelessness by population. So this is just the number of people per 10,000. And this chart off to the left is the result of us doing that analysis for the nation as a whole. This approach allows us to better compare how groups are doing. It minimizes the effect of some groups being smaller than others, and it tells us better about the likelihood of an individual group experiencing homelessness. So when we look at our rate chart, other groups came to the top of the list. Pacific Islanders and Native Americans are experiencing homelessness at much higher rates than any other group. But we still see Black people and multiracial and Hispanic and Latinx folks also experiencing elevated rates of homelessness above the national average of 17 per 10,000. The groups that fall below the national average are white people and Asians, who are the least likely to experience homelessness. We feel that there's a need to have greater focus on Pacific Islanders and Native Americans because of their numbers, but we also recognize that there are challenges related to data collection for these groups that may be showing up in our data and in our results. It's because they're smaller than the others, they're more difficult for both people who are doing PIC counts and for the census to count. But what we know and what is available suggests to us that there's some very real challenges within those groups that must be addressed. So I wanted to spend a little bit of time talking about, again, returning to the theme of the story of homelessness. I think that story looks very different depending on what group we're talking about, what subgroup we're talking about. I think so often people or thinkers and people who are doing work in general lump groups together if they are members of lump people of color together, but each group's individual story is very different. So I thought I would take apart two in particular, Black and Latinx people, to show how very different they can look. So for when we think about likelihood of experiencing homelessness, Black people experience it at 55.2 per 10,000, and that leaves them being ranked third amongst all other groups. But their number is far larger than the one that is for Latinx individuals at 21.7. And again, we're talking about literal homelessness. We don't have numbers available around related to doubled up status in this particular analysis, but we're talking about literal homelessness and people entering systems and being unsheltered. So, so we see a definite difference between those groups there. The disparity looks a little different when we talk about unsheltered status. So on that particular point, we see places to have a greater concern about Latinx people because they have a much higher likelihood of being unsheltered than Black Americans. So we have to address disparities and concerns about both groups, but the concerns they look a little different. In addition, when we move further down the list, we see that there is greater growth in unsheltered amongst Latinx and Hispanic, the Latinx and Hispanic groups. So this additional area of concern. Finally, I added a category where there's roughly even data points, and that's where we have the representation of families within the groups as a whole, which is reflecting the lack of in a good degree, the lack of available affordable housing for families, and particularly for families of color. So we have two different groups. They are ones that we should be concerned about, but the reasons look a little different, and the ways that we would address their challenges would look a little different accordingly. And so at this point, I'm going to turn the floor over to my colleague, Jackie Janoska.
Hello again, everyone. I wanted to take a little time to talk with you about some other findings. First, we're going to look at what the data is telling us about gender. And you'll see that there's some functionality in homelessness that allows you to look at both the total per the actual PIC count and then the rate per 10,000. So you can just filter to see what you would like. And just a quick note that we don't have census data for transgender and gender nonconforming people, so we don't have rate information for that. However, looking at data from the gender lens actually can help you really think about your system to make sure that you have the resources you need to serve everyone who's experiencing homelessness. So, for example, we see that the number of men experiencing homelessness, individual men that is, increased 8%, but their unsheltered homelessness increased 20%. So that might sort of lead you to think, well, do I have enough beds for men in my system if unsheltered homelessness is increasing? And we know that men are the largest subset of the individual's population, accounting for 70% of the people experiencing homelessness who do not have a family with them. So really what we're looking at is the really stark changes by each subgroup. So increasing 8% doesn't sound like a lot, but it is when you're looking at a group of people who make up 70% of the homeless population. But then when we looked at women, we saw that their homelessness increased 17% in the last 3 years, but their unsheltered homelessness increased 35%. So again, that might, if you look at the data in your community, might lead you to think about okay, do we have enough services for women? Why are women increasing their unsheltered homelessness in our community? Do we need to look at, our resources differently? Also, the number of transgender people experiencing homelessness increased dramatically over the last 3 years. But more concerning is their unsheltered homelessness increased by 113%. So, the concern, as Joy mentioned, is the equal access rule adjustments that the administration would like to make will actually make it harder for people who are transgender to get into shelter. And, their unsheltered homelessness is increasing the fastest, and they are a subgroup that is increasing their numbers rapidly, especially over the last 3 years, that we have data for. So it's really important that we, look at this population, even though, they are a smaller number, and, there are concerns that we're not able to capture everybody in the pit. What the data is telling us that we do have is that transgender people are, particularly vulnerable, and their numbers are going up really quickly. So we also wrote a blog post about the individual increases in gender or by gender for homelessness. And it gets into more of, the implications of what it means for being unsheltered and what additional challenges people face. And it talks a little bit about, what challenges are specific to each gender group based on research. So the next area that I wanted to talk about was the number of permanent housing beds in the nation. So overwhelmingly, every state except for one has increased their permanent housing capacity since 2007. It's actually been a 177% increase in permanent housing beds across the country. So it's really showing us that COCs recognize that permanent housing is what ends homelessness, and they're making those investments accordingly. 41% of the beds in our system are permanent supportive housing beds now. That's a 96% increase since 2007. And we know rapid rehousing is growing at a nice exponential rate. Just in 5 years, we've increased 87%. So, that's a really promising trend that we're seeing. And, these investments in permanent housing are going to be key to ending homelessness. And if you'd like to learn more about that, you can click the link to the blog and take a deeper dive into the reasons why this is, such a great finding that we're seeing. And then I also wanted to talk a little bit about at-risk populations. We don't have very detailed data on these groups, but we know that the progress that we've seen in the last few years is good, but we're still at a place that is 13% higher than we were and 12% higher than we were, just in 2007. So it's really interesting data to look at that, these are people who are, living on the edge of becoming homeless, literally homeless. And, given the COVID crisis and, the risk of evictions coming up, this is something we, like to pay attention to because, we want to make sure that when prevention funds are available, we can use those appropriately for people who might be newly falling into homelessness, and working on looking at who's homeless now. So, with the funds we have now, we can, mitigate homelessness before it gets even greater due to COVID, if that should happen. And then I wanted to also talk about the new functionality for state and local data. As Joy mentioned in the beginning of the webinar, if you click on your state at the top of the State of Homelessness report, it's going to bring you to a new dashboard, and it has a lot of in it that are really helpful for you to track your progress toward ending homelessness, including the trends by population type over time, the rate of homelessness per 10,000 over time by state. We also have demographic details over time. However, that's only the last 5 years, I believe, because that's all that we have the data from HUD. So it also allows you to evaluate system capacity on a sort of first step level. And I'll explain a little bit more about that in a moment. And then you can also see the changes in your temporary and permanent housing beds over time, which is actually a really helpful tool in figuring out how your investments in permanent housing look over the course of the last 12 years. So as I mentioned, I was going to talk about system capacity, and this is from the capacity tab in the data dashboard. And you'll see that it looks at the percentage of people that have a bed available to them, which was calculated by looking at the total number of people experiencing homelessness compared to the number of beds in that particular system. So you can see how many beds were empty for this particular system and how many people were sleeping outside unsheltered at a point in time. We broke this information down by individuals and families so that you could see what the capacity is to serve the populations experiencing homelessness in the community, broken down by household type. So for a system that shows that we have 103% capacity, you'll notice the utilization section says we had 1,047 beds empty, while 1,164 slept outside. So that would be a moment where if I was analyzing this data for my system, I would say, well, what's going on that we have all these empty beds, but there's this many people and families sleeping outside? The raw numbers show that we have, the beds available. So what's going on? And that would lead me to look a little bit further as to, are the locations of shelters convenient for families? Are there enough shelter, like entry points with coordinated access? Are, families encountering, difficulties getting to coordinated access appointments? There's a variety of things that could be happening, in this example. And in another example, I looked at a smaller community, and this is a community where you can think about your configuration of shelter. So they had no empty beds for individuals. However, they had 120 beds available and empty for people and families. So they have half the capacity they need for individuals and double the capacity they need for people and families. Again, this is a starting point. This doesn't mean that we need to drop everything and say this system needs to reallocate all of their beds. There's multiple factors that impact these things, but this is a really good starting point to look at your data and look at your system to think about where you need to be investing new funds. And I'd like to turn it back over to Joy to talk about rate information on the data dashboards for the state of homelessness.
Yes, so I'm a person who's really big on looking at rate information. You heard me mention it before, but I'm going to talk about it for a little while again. Again, it's putting our number of people who are homeless within the context of the larger population. This helps us to better understand progress over time, but also comparisons amongst different subpopulations. So on the right, you can see what this information looks like on our new dashboard. This is definitely a progress over time snapshot. We can see for this particular location, somewhat of a dip and a number that goes back up a little bit. We suggest that if you're looking at that rate information for your state, that you compare it to the national level. So for 2019, as I mentioned, the rate nationally is 17 per 10,000, and we can see that in this state it's 38. So we're a little bit elevated in the state, and that should cause us to think about the reasons why and what we can do about that. The other thing that our dashboards allow you to do is to look at the trend lines for other states and the numbers for other states. So this is state X. If you wanted to compare it to Massachusetts or Iowa, you can look at the numbers there too and kind of get a better sense of how we're doing in comparison to others. One thing that you may want to do in making comparisons is look at very similar states. If you're in Mississippi, you might want to look at another southern state with similar population and similar types of resources to get a better idea if you're roughly falling in line with the other state. If you're not, you might, if the other state that seems very similar to yours is doing much better, you might want to ask questions like, do they have best practices and policies that are different than what we're doing here that we might want to implement so that our line can start to look a little bit more like their line. So that is our goal. As I mentioned, I'll say that we have the charts that are there on the right on each state page, but on the main page, we also have a rankings chart that is fuller than it was in previous years, listing all states and COCs in order of their rates and also their counts. So you can see exactly where your state and COC fall on the list, and on a list based on population and not just purely counts. Again, that helps to eliminate the distortion of population, because obviously a place like New York is going to have far more people who are experiencing homelessness than a state like Iowa, largely because they just have a bigger general population. So, so we're hoping that these tools will help you to think through some of these issues and think about progress in relation to others, and start to ask some really good questions that could lead to system improvements over time. We also have included within the dashboards connected to each state at the top of the report, demographic information. For the states, it's broken down by rates. Again, allows for a more neutral comparison and a comparison within context of population. There's various ways you can look at this information. You definitely want to look at groups within the state and compare them to each other. So when we're looking at the top chart here, we can see that in this particular state that American Indians are the most likely to be homeless. Their line is far higher than some other groups. It's nestled pretty closely to Asian Pacific Islanders, and then some other groups fall lower, and we can determine how the groups are relating to each other and their experiences, their likelihood of experiencing homelessness. We can also make other comparisons similar to the ones I discussed in the more general charts. How are individual subgroups faring compared to the larger state rate and national rates? So the national rate again is 17, and we have some groups that are maybe 39 per 10,000, 150 per 2,000, 200, so forth. So you want to look at each subgroup in relation to that. If you look at the dashboard at the top of the page, it would also tell you the general rate for the state. That's another good comparison point. Again, you might want to look at how transgender people are faring in your state compared to others, and if there are some differences there, begin to ask some questions about why. And lastly, I would say you can track some changes over time. I pulled some particular data points for one subgroup in one state, which is Black people in California, to kind of show an example of the type of analysis you can do. So again, here we see a group that for which 194 out of every 10,000 are experiencing homelessness. That number is much higher than the 35 out of every 10,000 for white people in the state, and the 31 for every 10,000 for Hispanics and Latinxes. So we know that this is a group that is experiencing some particular challenges and is experiencing a lot of inflow into homeless services systems. And we should be thinking about why and if there are things that we can do to address that. We can also take that rate and beyond comparing it to other subgroups, we can look at, again, the overall state number of 38. Obviously, it's much higher than that, and even more higher than the national rate of 17. Again, it's good to look at other places. So click open some other maps or look at the rankings chart. Here, I tried to look at a state that was similar. So for California and New York seems similar in that there's some major cities there. They have significantly large populations, a fair amount of income inequality, and a fair amount of diversity. So, and for those reasons, those two states are often compared to one another. And I see that in New York, the Black rate of homelessness is 210. Similar to the 194. I guess California has a slightly better number. So maybe we can think about starting some connection with New York so that we can jointly brainstorm and think about ways that we can address challenges for this group in both of our states. Maybe we identify still other states that are similar, that are making greater progress or have better numbers, and connect to them and try to identify best practices. But making useful comparisons is helpful to our understanding of the problem. If we look at the trend lines, we can see that as with the national numbers, the Black rate of homelessness has been going up since 2016. So we know that Black people are very much a part of that trend, but maybe to a lesser extent than other groups. Finally, sometimes when we're doing this analysis and we look at the comparisons, we notice something that we weren't expecting. So should we be taking a look at other groups like Hispanics based on the comparison that we were doing? The Hispanic line here looks a little bit different than what we saw nationally and what we see for other states, and that the Hispanic rate of homelessness is lower than for white people and lower than a lot of other groups. So it could be, so that at this point we could start asking ourselves some questions. It could be that California just has lower, just have Hispanic and Latinx population that is less likely to experience homelessness. That's what we would hope. We don't want anybody experiencing homelessness. But we could ask ourselves additional questions. Are we experiencing challenges with counting that group? Is there some other issue that is happening where, well, we would want to look at if we're experiencing challenges counting the group, if somehow we're not otherwise reaching that group. So we could start to ask and seek out the answers with additional data. So finally, I'll mention that our dashboards do have some CLC level data to get you started with, particularly homelessness counts. So you'll be able to see the groups in each COC that have the greatest numbers in the population. And you can begin to consider that within the overall story of the state. So you'll have fuller information about the state. You can start to think about additional questions that you might want to ask yourself based on comparing the COC and the state numbers and looking at the full picture. So for example, I started with California and I thought I would pick one of their COCs, the one that I was born in, San Francisco. So the count line for Black people in that particular COC falls higher than it does in other states. So, I mean, I'm sorry, higher than it does for the state in general. So the state in general has a certain order of groups. It has a certain order of groups, and clearly within the state line, the state lines, the Black line falls lower, but in the COC it falls higher. So we're seeing more people, more Black people being homeless in this particular city. Why is this? That's the question we want you to ask when you look at numbers like that. We might be thinking about the fact that San Francisco may be more diverse than other cities within the state. We might be thinking about income disparities. We might be thinking about cost of living there. We might be thinking of a long list of related reasons, but we should have some understanding about why those disparities are occurring, and then take the next step to think about if there's any way that we can help to reduce those. Finally, I'll mention that there's additional information available in the AHAR that could help with your thoughts on this. So that is something to keep in mind. And we wanted to highlight some things for people who may be handling or working with their systems data. The Alliance has a race equity tool that helps think about what questions you're asking and how you're analyzing that data so that you are better able to think about racial disparities and areas where there are concerns. HUD has a similar tool, which we also found a link for. And finally, if you are one of the people who have access to Stella and its information, it does a lot of work helping to understand racial disparities as well. So lastly, we definitely want to thank you for attending and spending some time with us this afternoon. We'll move to the question and answer portion at this point, and we'll try to answer as many questions as possible. We're leaving our contact information on this last slide. We are available to help you think about your data and answer questions about the state of homelessness. So Jackie, do you want to start with the question?
Sure. So we have a question that's asking about if we can drill down the numbers of people experiencing homelessness by age, but also be able to drill down by gender and race and ethnicity. And that question I can answer. Unfortunately, the answer to that is kind of no. You can't do cross-sectional analysis with the PIT data because they report it in aggregate. So we can tell you how many people were experiencing homelessness who were between the ages of 18 and 24, but we don't know necessarily what the breakdown is by race and ethnicity for that particular group. So like we can tell you we had, X number of 18 to 24-year-olds. We can tell you that we have X number of people who are white, X number of people who are Black, et cetera. But where the breakdowns happen in, each category is not easily done with PIT data because of its aggregate level. So, so it becomes a little more difficult to say like, okay, we have like our population of 18 to 24-year-olds is predominantly this race or this gender. We don't necessarily have cross-sectional data for that. Let's see.
And I'll just add to that, a lot of our analysis is based on the PIT. HUD has additional data sets that are tied to the people who are served within its within shelters and temporary housing. That has a little bit more information. Our analysis just didn't reach that. We're mainly focused on point in time.
Okay, so the next question looks like it's for you, Joy. With the transgender disparity, is this also possible due to the data collected now that includes the option on surveys where it did not before, and also the increased acceptability of identifying oneself? Are they new to homelessness or just new to identifying themselves?
I think your question does point to a factor that is happening. So over time, in all points of this collection, it's getting more accurate, hopefully. And there are various factors that would say that we're getting more accurate counts of transgender individuals over time, and that we're getting more accurate counts period over time as everyone learns how to do the collections better. We haven't really been tracing transgender homelessness for the whole history. It's only been the last 5 years. So the changes that we're seeing are not ones that should show a great deal of that progress, because it's within a very short period of time. And when we did a lot of our discussion, we were talking about the last 3 years. So although improvements in collection probably are happening over the last 3 years, they're probably not monumental within that time period. And I think importantly, if we're looking at the 2019 numbers, those numbers are concerning, both in the number of people within that group experiencing homelessness, but also specifically that both me and Jackie pointed out, that the number of them that are unsheltered, who systems just aren't reaching. So that is a concern, and that's something that stands apart from whatever we discussed about the trends over the short period of time in which we've been collecting data on the group.
Okay, we have time for one last question. If we haven't been able to answer your question and you still would like to reach out to us, please feel free to do so. The final question is, it just scrolled off of my screen. It is, sorry about this. Wondering why Pacific Islanders represent the highest rate in the country, and is there information on which states are particularly impacted by Pacific Islander homelessness? Do we have answers to that situation? I'm a little hesitant to speculate, like why Pacific Islanders represent the highest number. There could be a multitude of reasons, but Joy, if you want to also expand on that.
Yeah, that's a group that definitely has higher numbers in a small number of states. One of them, I think the one where the highest number is Hawaii. Mm-hmm. And that is again, I should know, as Jackie said, this is, we should first look at that national data number and know that we should ask additional questions. But one of the potential reasons for that is the nature of Hawaii, income disparities, cost of living there, probably things that go into the history of the islands and policies and so forth. I'm not an expert on Hawaii, but I would think that for the limited number of states and the places where Pacific Islanders are found, there's a list of questions that should be explored, and they should determine if those are definitely the causes.
All right, I think that takes us to the end of the webinar. So again, thank you all for attending. And please feel free to reach out to us if you have, additional questions. And as we mentioned earlier, the slides will be available and the recording will be sent out to all of the attendees once the file processes and it's ready for viewing. So thank you all again.
Thank you. Have a good afternoon.